Diarrhea with acupuncture and Chinese medicine case study. I only able to do one case because this case, when I present, I thought I can do about 3 cases. So you guys can have a look how I treated those patients. But ended up that I only have time to prepare one, and this one is actually quite long. And I have others as well. They are quite long as well because we're treating them because a lot of things that we need to discuss in the case. And I want you guys be able to communicate with me in this webinar and tell me if I ask question, and then I want you to respond as well. Okay. Right. Let's go to the next page. And this page, this is about the keynote for today. Diarrhea case study and what is the difference of medical 8 and medical 12 in treating diarrhea. And it's something that I'm gonna show you guys and tell you what is the difference between those two, because those two acupuncture strategy are very good for treating diarrhea. But what are the difference between them? And what is the best strategies, right? And what diet is the best for diarrhea, all right? This is something we can discuss, and there's no right or wrong, okay? As long as it suits the patient, okay? And it's come with experience as well. And I have my answer. You may have your own answer. So I'm going to talk about my workshop in March next month as well. And there is a bonus of medical aid webinar if you want it. And in the end, you have to say in the end, and then we'll give you the link and tell you how to get the bonus of medical aid webinar. Okay, the first case in here. So this case, the main complaint is diarrhea and type 7. What is type 7? All right, we're going to go to the next page first. So this is the bowel motion type that I actually show all my patient. I print it out and I eliminate it. So every of my like all my treatment room, I stick one on top on the wall, and I actually show to all my patients and tell them, can you show me, which type of bowel motion do you actually have every day? If it's 1, if it's 2 or 3, and what type of day, or between. So this patient is type 7, watery. So watery bowel motion. Now, as a Chinese practitioner, herbal practitioner or acupuncturist, diarrhea, watery, that is not right? So what is a normal one? According to this chart, the normal one is type 3 and type 4. Type 4 is better, or 3 or 4 will be okay. Okay, anything in type 1 and type 2, that's not good. 5, 6, 7, they are abnormal. So 3 and 4 considered normal. So this patient's type 7 could be 5 times daily, okay? And then feeling anxious. This is all what we have a very complete form that patient need to fill in. And this is what patient actually fill in herself, right? So, and then I copy and paste it on my notes, and I just, change a bit according to the patient, what she put on, okay? Could be up and down all night, which means she told me that every hour, sometimes every hour, she need to get up to go to the toilet. So this is how bad it is, okay? Can lose weight because of that, osteoporosis, osteoarthritis. So this is on top of diarrhea that she suffered from those. Has been diagnosed as IBS as well. So IBS, bloating, and IBS, irritable bowel syndrome. And some patient would be like constipation, then diarrhea, constipation and diarrhea. Sometimes they go to toilet and very difficult, or sometimes they don't. They go every day, a few times a day, or sometimes a few days they don't go, but as soon as they go, they get diarrhea. Then patient will think that they constipation. But when you ask them about, whether they form or not, they say, well, when I go to the toilet, I don't go for a few days, but when I go, it's all loose. And this is not considered about constipation. But in Chinese, we know BME. BME is, definitely is type 1 or type 2, right? But even though you skip a few days and you go, then you still get loose bowel motion, and you will call 泻泻, you won't call 便秘, right? But I find that for Kiwi, European, when they say constipation, they would say, well, I have constipation, which means they don't go every day, and they will say constipation. And when you ask them about which type of your bowel motion when you do go, and they will say, oh, type 6 or type 7. They don't go for a few days, but when they go, they get loose bowel motion, watery bowel motion. In Chinese medicine term, this is not constipation. This is diarrhea. But a few patients, they will say constipation. Okay. Or even in our form, we actually put down constipation and diarrhea. And some people will take that. Okay. I'm bloating for 30 years. Bloating for 30 years. That's what she put on. She wrote it in here. And osteoarthritis in the wrist and fingers. Okay. And she has done bone density test for it. So diarrhea level, she said about 8 to 9 out of 10. That's how serious that she thinks. Right? She thought it was okay. Constantly being on the toilet, being about 10 years ago for this diarrhea, and anxiety about not finding available toilet when she is out. Better is if she's staying at home. All right. So she's a church person. She will meet a lot of people. So she's very worried about that if she's going to meet with people, it's social thing, and she won't be able to go there because she's too anxious about she need to go to Thailand all the time. It would be bad sometimes. She had done many colonoscopies and bone density scans. She has also had a repair gastric bypass 7 years ago. The original stomach stapling was done about 30 years ago. So interfere daily activities, like interfere with her work, sleeping, because you need to get up to go to toilet sometime every hour. So emotionally, like anxious, worry, all this thing. So interfere with the social life, recreation, all this thing, right? Okay. Next one. Second complaint. This is a bit smaller word. I hope you can see it. Second complaint. So most people don't know about whether we actually have main complaint, second complaint, and third complaint. And so they try to put a lot of things on main complaint sometimes, and then they realize, oh, there's second complaint, and then the first complaint is about diarrhea, second complaint about osteoarthritis and osteoporosis. So 5 to 7 out of 10. That's how serious it is, she think. So family history for that, and being a low body weight as a cause of it. That's what she think. Okay, this is being about 5 years ago. Started 5 years ago. Worse when overuse of a joint. Better not doing too much. Fiddling hard work or wrist work. Has done straps for her wrist and has seen physiotherapists. Interfere with overwork in the garden or cleaning. There's some question we ask about what she actually wants. I don't know why you leave the webinar suddenly. It's better you use the computer to log in so you can stay and check your Wi-Fi as well. Don't use your data to watch it because it actually slow it down. Hi, Shirley. Okay. Now, in our form, we actually ask the patient what they want. Okay, so are you here visiting us because you want to find out and correct the root cause of your health problem? That's what she wants. Okay, if possible, and start a lifestyle program for optimized living where your body can heal itself without medication or be less dependent upon medication. Now we have few options for patient to choose. Some patients just want a symptom relief, so we want to know what the patient think about what they want. Okay, so we are not treating patient with what we want. Some patient doesn't care about the root cause. They just want symptom relief, and if that's what they want. For us, we always tell them about what is symptom relief and what is the root cause. We ask the patient, what do you want to treat? And the patient will choose what they want, and that's what we treat the patient according to what they want, not according to what we want. Yeah, I use computer now and better reception than using mobile. Thank you, Shirley. So the next question we asked her is, if we were to sit down and discuss your life 3 years from now and look back at today, what would have to have happened for you to be happy with your progress? And the patient said, normal toileting habits, right? No more thinning of my bones, no more advancement of arthritis. That's what she wants, you see, in 3 years. How important it is for you to resolve your health concerns. And out of 10, and 1 being lowest, 10 being highest, she put 10, right? So this is important for her. What is it important to you that you get rid of your injury problem as soon as possible? I just want to live a normal lifestyle. You see how serious is this patient going to about her health? Okay, this is the question that we ask patients. This is part of it. Okay, do you have any allergy? Okay, she has an allergy. Okay, anyway, I'm just showing you when this is something that we ask our patient. Let's get to the next one. Right. Apart from main complaints, second complaint, all our patient, they need to fill in. This is all my patient fill in the form, all right? And I just copy and paste to show you. And we check all the organs. Whether all the organs, do they have any symptoms according to all the organs, right? So heart and small intestine. We know heart and small intestine are the belly relationship, right? So we put those 2 questions together, and the patient just take what they suffer from. So they actually save us a lot of work to ask. So and then we can review it before they come in. You see, we know what's going on already. If we have time, we do it before that, or we quickly do it, preview it, and then before they come into the office. Heart palpitation. You see, now we know. And guess what? When patients fill in those forms and they know what they suffer from, according to Chinese medicines. Heart palpitation. So that's what staying asleep. She has trouble staying asleep. Waking up unrefreshed, tired, mental sluggishness, fogginess. All right, some fogginess. Palpitation, heart fluttering, bruise easily, anxious, okay, not very happy in general. This is all about heart conditions. lung and large intestine condition, asthma, only when she get a cold, right? That's not so much important, but that we know that, the patient know when you feel in, okay, this is actually from the lung. So when they feel in, it's actually a education thing as well. We let them know what organs control what symptom, if they have what symptom that relate to what organs, and that actually help us to explain and diagnose. When we diagnose, we tell the patient which organ are out of balance and which organs belong to which symptom belong to which organs, things like that. And then we take the pulse and look at the tongue and explain everything, how they link together. Liver and gallbladder, dizziness, poor balance, vertigo sometimes, okay. Bitter taste in the mouth, joint pain. The joint pain is about the arthritis, right? Blurry vision, decreased night vision, floaters in the eyes, worse in the right. Okay, floaters. A lot of people have this symptom, and I find that when you treat the organ, the floaters will decrease or disappear in 1 month. Most people, but some people will no change. A few people no change. Few patients no change at all. The floaters actually get better in 2nd month, right? So everyone's a bit different, but I find that if I treat the organs, most patients get better. They see the result in 1 month. Osteoarthritis, mood swing, anger, irritable. So this is there are 3 organs imbalance in here. So kidney and bladder, hot flusher after hot cup of coffee, night sweats sometimes only in summer, thirsty all the time, lower back pain when she get bowel motion. BBM it's actually BM, just bowel motion. If I type BBM my computer, because I have a shortcut, and BBM will come with herbs. So a BM, so I put BBM as bowel motion for myself, for my reference. Pain go to left lower back and left hip. That's when she go for bowel motion. That's how she experience every time. Wake during the night at least 1 time to the toilet. We know this is kidney, not good. Easily started. General weakness, low energy, chronic fatigue, low or no libido, spleen and stomach. Okay, stomach pain, nausea, gas, IBS, external hemorrhoids, fatigue after eating, loose stools, diarrhea, that's what we know, undigested food in stools, abdominal bloating, gurgling noises in stomach, constant hunger, bad breath, weakness in the muscle, whole body feel heavy, muscle twitching, cramping, spasm, sugar craving, sleepy after meals, bloated after meal, anxious. All right, you see all the symptoms. Now, what about this? This is about her surgery, okay, and what she's been taking. Okay, I want to talk about this in here. She's been taking Nocturne, for fibromyalgia, and that's what she put on. Okay, but this herbs, this drugs been, so other drugs is she only take it when she need it, but she take this over 10 years, 20 years, I can't remember, 3 per day, right? And I said, well, do you get pain all the time in your muscle? He said, no. How about joint? Just fingers. That's it. I said, why do you use this drugs? This drug shouldn't be taking it for years. Well, she didn't know that. She said, well, and I said, well, Google it and get this, look at the side effect. If you don't have it, you don't need it, all right? And she Googled it, and she found all the side effects. And she said, well, she didn't need it. She said, I didn't get depression, and why do I need it? That's what she said. And she was quite upset about that the doctor didn't actually explain to her why she needed and why did she need to put her on. And she actually didn't ask about it. Why did she need it? Okay, and she just took it for years, and now she's trying to cut it off, because when she read the side effect of it, she know this is bad. And I told her, yes, this is bad. When we look at the pulse and we look at how her liver, because all these drugs been taking over years, and it will harm her stomach and spleen function as well as liver. And when I explained to her and she accepted and she really looked at it and she want to get rid of it, I said, well, the best thing for you to do it, and because this is a prescription, I'm not allowed to stop any of your prescription, but I know this prescription is not good for you, and I have been helping patients to reduce the medication for them. And I actually have some video that my patient actually our patient reduced the medication, and they were very happy. And I think one of them I put on YouTube. It's about 22 pills a day, and that's just one of our patients. And so now he is drug-free, no medication at all. So I actually showed the patient how this guy John talked about treatment and about how he get rid of all the medication, and he was quite pleased about it. And she was so happy that to see this video. So this is important. So we tell the patient we can help them, and we get a patient to talk about when they've been to our treatment and how they feel. Okay, and I actually don't give it to all my put it on website for that. I just put on a teaching on video, because it's a testimonial. We're not allowed to actually show in public. But I just showing a patient that we actually can do it, and the patient trusts about it. We start the treatment for them. And for the prescription drugs, we actually, even though even though I know that how they slowly cut down the medication, and we can, the way to stop the medication, but you're not allowed to actually advise them. I always tell them, hey, this is a prescription drugs and medication. I advise you go to your GP and discuss with the GP how you can cut it down. And I actually tell them, if the GP doesn't want to cut it down for you, and this is your right to get the information from the GP. If they're not happy with that and they don't want to help you, you let me know, and I have other GP who are happy to help you, and I'll refer you to other GP. That's what we do. Okay, then after all this, I actually give patient a treatment plan, right? A treatment plan. Okay, so our goals for this treatment action plan is we set up a goal together, right? To balance stomach and spleen function and reduce diarrhea and eventually stop diarrhea. So you want to give patient what your treatment, you want to let patient know what this treatment actually aim for, right? Second, to reduce pain and get you more mobility and back to enjoying your cooking and back to gym, because she couldn't cook because of pain in her fingers, right? The pain prevented her, and as well as the diarrhea. And gym, she need to stop the gym because she can't do it. She need to go to the toilet, and she hasn't got the strength to balance. So people think that they go to the gym to build up the muscle, but if your organs are weak, you don't have the strength to go to the gym, right? To balance all organs function, to preventing for preventing bone getting thin and arthritis getting worse, right? This is what we summarize for a patient to balance emotional energy. So my plan, good question. How old is this patient? I can't recall. Let me check. I can get two of my. Oops. Hmm. Give a minute. Let me log into. Yep. So now I'm not very good to tell patient age. I better check it. I have few cases. When you treat diarrhea or IBS, you find out all these patients are similar. The symptoms are similar, so I don't actually recall how old are they. And she's 73. Okay, she's 73 years old. Okay. So once we give them a goal, every patient, we just give them a goal. And this goal treatment action plan is actually for a month, right? One of my master told me, she's in Auckland, Zhang Ling, Angela Zhang, and she said, we heal patient, we help patient to get better, not through one treatment. You never fix patient, or you never get patient out of symptoms or heal the patient with a sessions completed with session. You actually complete it with treatment course. That means that we are better off to explain to patient and to give patient a treatment plan rather than and patient wanted to, they are so pleased that they can have a treatment plan rather than they come in and then they go away and they come in and keep asking you, how many treatment do you think I need? We receive all this question a lot. How many treatments do you think I need? And when they get better, they ask this question. When they get worse, they ask this question as well. So this question is not about whether they get result or not results. They will always ask you, how many treatment do you think I need? And what is your question if you get this question? Question. Can you tell me, if your patient asks you about what is your answer? Can you share with me, please? I think this is important because when we treat patients, they ask this question, and I actually very honest to them. If I don't know, I tell them I don't know. And most of the case, I tell them I don't know. Yeah. So that's good. Hearing, a mantra say hearing process is different from a patient to another. Andrea say it depends on the condition. We focus on muscular, skeletal, and say we try within 5 treatments. That's good. Good answer. I usually say it depends on each person reactions. Yeah. Every patient is unique. Yep. Depends on the individual conditions. There is a certain term to say. Okay. Yeah. There isn't a certain. Sorry. I usually suggest 6 treatment, then we assess. That's good. You know, I love that way because this is what we do. You suggest certain treatment, and then we do a reassessment. That's what we do because we never tell. I say every patient is different, and I will assess after 6 treatment. That's good. Yeah, Angie. Yeah. So I don't really do 6 treatment. I actually do a month. So I do a re-examination a month. So before I see I start the treatment. So I just show you all what the patient fill in the form. This is all about form. I just copy and paste into here. So the patient actually fill in everything, and then I just in my first initial examination, I just sit down and talk to patient and review all this form. And if anything that is positive, I need to dig a bit deeper and I'll ask more questions to patient. Then I take the pulse and I look at the structure, I look at the tongue and everything, and then tell them what's going on, what is the diagnosis according to Chinese medicines. Then I give them a plan. Try a couple of treatments. Patient's different, and I will assist after 6 treatment. Yeah. Everyone's different. Okay. Yeah. So we know everyone's different, but you can't just tell patient everyone's different, because if you just tell patient everyone's different, think about if you go to a practitioner and you ask the question, what would you want the question to be? We all expect a number, right? But unfortunately, we can't tell them exactly what number they will get healed. Instead, we'll get them a number, but we tell them this number is not about. This number is not equal to or better. It's equal to reassessment. Aaron said, patient come to us as if they are broken. They would like us to fix them. Yeah, I asked them what will be the difference that will make the difference. Okay, lifestyle, prescription medicines in between treatment will help us all to teach our client and help themselves. Yeah, see how your body react. I need to check your body conditions. Yeah. There's no right or wrong answer. Okay, there's no right or wrong answer. It's just about sharing, and I love the information that you guys share. Thank you. And I always tell the patient, I present this plan to them, and I actually get them to say, well, this is a month plan, and I want to see, we want it within a month, okay? And we're going to sit down again and do a re-examination, and we'll see how well we respond to the treatment. You know, if there is any improvement or there's anything getting worse, then we're going to sit down, we're going to discuss what is the next plan. Do we stop the treatment? Do we cut down the acupuncture? Do we cut down the Chinese medicine? Or do we need to increase anything? All right. So after showing the goals of the treatment, then this is my plan. 1 acupuncture treatment per week. I need to do 1 acupuncture per week for 4 weeks. The practitioner will use a variety of acupuncture techniques to suit your individual conditions. This treatment may include other techniques such as electric acupoint stimulation, heat treatment with herbs or without herbs, and or cupping. The practitioner will work out which treatment best suits your individual conditions, and this may change from one appointment to the next. We just need to read it out to our patient. We print it out of this and give it to our patient and read it one by one to our patient. And so one herbal prescription per week for 4 weeks. So 4 weeks worth of Chinese herbs, right? So you may confuse what is herbal prescription per week for 4 weeks. Herbal prescription is my patient come in, I take the pulse, and I write out prescription. It's similar to they see the GP and they get a prescription and the GP charge them. And I charge for this service as well. Now, if you haven't charged for this service, your patient come for acupuncture, you just give herbs and you just charge for the herbs. And I would suggest you start charge your service because this is important. Think about if your patient just come to you want herbs, do you charge the prescription service or not? If you do, then you want to charge them as well. Okay, and this is important. I used to miss out this one because I used to just do acupuncture. If they need herbs, I just give them herbs, and I don't charge an extra. But now I do. We've been doing it this way. All right. So 4 weeks worth of Chinese herbs is we use herbs, we give them herbs, and the herbs are all extra. Heat on abdomen for 30 minutes daily at home. So this is part of the homework that they need to do. All right. That's good. Now Kim charged it and Aaron charged it absolutely. That's good. Thank you. Then apart from that, I actually we have a dietary review and suggestions, emotional daily practice, 3-2-1 acupressure program. All right. So as you see, we in this today topic we talk about acupuncture in Chinese medicine, right? But actually, if you look at my plan is actually not just for acupuncture and Chinese herbs. There's about lifestyle as well, diet. If you're treating diarrhea, you're not suggesting the best diet, and then you won't get them to the end. You won't complete the treatment. They may get better, but then they will fall when they stop your treatment. What I look at it is changing diet, right? If the organ function is low, it's supposed to be in here. Changing diet will improve. Sometimes changing diet, a lot of time, not sometimes, it will improve the function to here. Then with your acupuncture, it can get up to here, back to normal, right? Now, if you are not advising the right diet for your patient, then you get treatment, the organ function are up to here. Then you keep going with treatment, you will find that, okay, it seems like it's not getting any improving anymore. It not seem to be progressing. That's because they are still on the bad diet. So no matter how you treat them, the organ function won't get to here. So that's about lifestyle, and that's important. So, and with my treatment, when my patient, they change the diet and they watch the diet and they do well with the diet, I can see a big difference. They can quickly go through, and within 1 month, they'll get very good results. Same as the others, emotional daily practice and 3-2-1 acupressure program. So I actually introduce them some acupressure point. So if they do it, if those patients do acupressure point program every day, you see it's very different in the results. And those they are not doing it, or they do it sometimes not doing it, you can see that the results are not lasting as well, or always up and down, right? Yep. Lifestyle is always the hardest for them to follow, especially diet. I agree with that. That's right. Lifestyle prescription medicine most important. Yep, I do agree with you. All right. So all this, the patient sign up, we actually give them prepaid all the payment for a month. Okay, they have to do a commitment. This is a commitment. I tell them this is a commitment. If you want to get better, it's not about 1 or 2 sessions. It's about treatment course. It's about the action plan, right? And we give them discounts if they paid in advance. We're not talking about business today, so I'm not going to talk about how you get the patient to pay and how you get patient to how much you charge them. This is not about this today. We just focus on our case study. Daily emotional daily practice is something that I actually I have to tell the 6, 7, 8. I used to go through with patient one by one, and I found that I always say the same thing. So I put it on video. So we send it to our patient, and the patient need to watch it. Okay, and when they come back for follow up, we actually follow up with it. What about the diet? Have you watched the video yet? If there's any question, can you follow that? Can you make a change in your diet? Or have you been doing the emotional day practice? Do you have any question for that? And do you know there's a book that you can buy and dig deeper? And 3-to-1 acupressure program, is there any point that you're not sure about? We can, we are sure that they know about it. So the emotional day practice is everyone have a, in Chinese medicine, all organs link to, if they're out of balance, they actually link to emotional energy, right? So anger, that's liver. So apart from needle, you give them needle. If you're only doing needle in the acupuncturist, if you only do the acupuncture, you needle it 2 times weekly, but things happen every day. How well can you prevent all those things that happen? We are not actually preventing those things happen. We are actually trying to get the organs balanced so they will deal with things much easier. I always tell my patient, we can't control things happen around us, but what we can control is how we respond to things. The same thing that happens to you and me, you may get angry, but I may just laugh, you see. So emotional daily practice is a tool. My patient get very stressed. A lot of people get stressed, right? Stressing life at the moment. And I ask them, do you have any tool to get yourself relaxed? What tools will help you relax? Some patients will say meditation. I just say, that's good. Have you been doing meditation every day? If they say no, I actually suggest you do meditation every day. That's it, simple as. Some people say, well, I'll go for a walk. I said, go. Have you been going for a walk every day? They said, no, I haven't done it. I said, well, you should do it every day. If you're very stressed, something that's working for you, go for it. And some people just listen to music and say, this is something you need. And some people believe in God. They pray and they feel peace. I said, this is something that you need to do it every day. We here just reminding them to do it. Okay. And I have an emotional day practice that's yes, I do have one. This is something that worked for me. This book called Zero Limit. You guys can find out. It's Ho'oponopono method. It's only comes with 4 phases. I love you. I'm sorry. Please forgive me. Thank you. That's 4 phases. I actually use it a lot, and I use it for my patient. And I ask my patients to learn it, and they can do it for themselves, and they can do it for everything, including the physical organ functions, and it works beautiful for all my patients. Can I suggest patient to have block? There is always resistance to change. If there was no resistance, they would easily change. I found that patient that had homework when they were young at school, they see and hear our advice as homework, they won't do it. We have to help them to see these blocks. Okay, good idea. Do you know the author? Yes, the author is, who was it? Can't remember. Google it. It's about Ho'oponopono method. Ho'oponopono. Ho'oponopono. I think this is the spells, right? Yeah, hopefully that's right. Yeah. Right, we keep going, right? This is the treatment that I give my patient, right? It's actually last month, 16th of January. So I took pulse. I checked pulse. And the pulse, I'm going to teach on a workshop next month, right? So my strategy in here is actually Magical 12. Magical 12 is Dr. Tan's method acupuncture, right? It's come from Dr. Tan. But the way that I do Magical 12 is a bit different. I use actually pulse. So I take pulse. Then I find that this patient in this time, the pulse is liver strong. But I actually should put liver and gallbladder strong, which is wood strong. That is the right diagnosis. Not about liver, it should be wood strong. It represented the liver and gallbladder working too hard, excessive, right? We call 太过. That's why in Chinese we call 太过. 实, that's why I put strong. If you look at here, wood strong. This is the pulse. And the treatment principle. When wood strong, you reduce wood, right? And reduce fire. Because wood support fire, right? So there is a principle. If you're treating excess, you reduce the sun of the element. So the fire is the sun of the wood. That's why we use it. Then metal. You increase metal. Why you increase metal? Why did I do that? When I increase metal, and the wood and the fire will decrease. This is the purpose of it. So when I have this treatment principle, then I have this organs, which means you reduce liver and gallbladder, and reduce fire is heart and small intestine. What is metal? Lung and large intestine increase, and that's the point that I use. Okay. So those points are liver 2, gallbladder 38, heart 7, small intestine 8, and lung 9, large intestine 11. There's no direction, just perpendicular to the skin, right? And you don't have to do it deep, just a little bit. And I use 15 mm needles time 0.15 needles, very thin, all right? Then the rest of the meridian, 12 meridian, right? Magical 12, it means, yes, to cut the wood. Magical 12 means each meridian, you choose one point to treat it. And according to the post, we need to focus on wood in this treatment. Then the rest of the meridian, I use Harari point. So PC8, pericardium, and Sanjiao 6. Spleen and stomach, spleen 3, stomach 36. Kidney 10, and UB 66. So why do I choose Magical 12? Because this patient have stomach problem, first thing, or bloating. So how many meridian over here? A lot. And the patient actually have back pain as well over here, and all finger joints that's involved with pain in here and worse as well. So all the 6 meridian over here, hence 6 meridian involved with pain. There's all 6 meridian. And Magical 12 is one of the global balance strategy and Dr. Tan's balance method. So in global balance method, we actually treat the 6 meridian. And all foot meridian up to here, apart from the bladder meridian, but she actually had back pain as well. So this involved with all 12 meridian. So we treat all 12 meridian. Although we know diarrhea are more under stomach and spleen. If you just ask the question, you know, okay, this I need to treat the stomach and spleen function, and you will give the herbs for what? Just stomach and spleen function, or maybe kidney diarrhea, right? And you would never thought about the other meridian you need to treat it too. All right. So my treatment plan, protocol is a bit different in here. So Magical 12 in here. So go to the next. Could I say the point again? So which point do you want me to repeat? We'll go for more, okay? We'll go for more. The point in here is, this is a sun point for, we want to reduce the wood. So this case is wood too strong, liver fire, attach, spleen function, correct. Well, you can think of that way. You can understand in that way, but it's actually, I look at the whole body. When we look at the let's go to the symptoms, okay? You see the symptom in here. She had heart, small intestine symptom, lung, large intestine symptom, liver and gallbladder symptom. She had kidney and bladder, spleen and stomach. You know, all organs are out of balance. Would I treat just one organs, or pair of organ, or few organs, or treat all the organs? And all the symptoms actually related to 12 meridian. That's why I choose Magical 12. But when we choose Magical 12, do I treat all organ equally? No. We know some are working not as well as the others. Then which one do we need to treat? In Chinese, in Huangdi Neijing and Nanjing, we treat 独处常间. We choose the worst one to treat. And how do we find the worst one to treat? I'm not saying we're not treating the others. We treat everything, but we need to focus on one. And in this treatment, and how do we find out? If you, by asking the question, it's difficult. You don't know which one to focus. But by the pose, when you go to pose, the pose will tell you which one out of balance the most. And that's the liver. Right. Then when we know, we use post-diagnose to choose that, to understand which one out of balance the most, we treat that. And then we come up with the triangle treatment principle, treating wood strong, then we reduce wood, reduce fire, and tonify metal. And then once we have this principle, then we will have the point. And the point is, if excess, we needle the sun. If we need to tonify as weak, then we need to do tonify. We needle the mother of the elements. And the rest of it, we just do Harari point. That's it. Okay, you lost sound. I hope you get back soon. Okay. You see, I do this acupuncture point. Then when I needle it, I check the pulse. And the pulse, the level strong, start to come down. Right? It was strong and now it went down. Then I know my strategy is the right. So we use pulse to diagnose, and we use pulse to choose the point. Then we use pulse to check whether our protocol strategy is right or not, it's good or not. Do we change the pulse or not? That's according to Huang Di Neijing. Okay, I put heat pack on tummy, on belly button, a huge heat pack on top. I do another acupuncture for GE 4 point. That's due to back pain after laying flat on back for 20 minutes. So she didn't actually mention that she had a lot of back pain, but after laying flat for 20 minutes, she barely get out of the bed. That's why I ate all GE 4 point and just for her back. All right. Then the Chinese substance here, guizi. So you can read Chinese English in here, but I can't. I don't normally read the English. I know 桂枝子时 38, 生地茯苓 16, 人参生姜 1.5. So all these herbs, these are for wood. We're not discussing herbs anyway. Put it in tea bag. All these herbs, put it in one tea bag. Put 7 tea bags for 7 days, and take 1 tea bag with hot water and sip through the day. All right. Can you use moxa on belly? Yes, you can. But the reason I use heat pack because I don't have time to do moxibustion for a patient. All right, so I put heat pack on. That's it. And then I can go to the next patient. You can use heat lamp, no problem at all. So after 7 days, 23rd January, so BM's bowel motion down from 5 times to 2 times during the day. No longer waking up at nighttime every hour for bowel motions. So that's been stopped. Joints, wrists, and ankles still. The pain still. All right. Lower back pain when laying on back actually for a long time. That's still. Sleeping is much better because doesn't need to go to toilet at nighttime. She said that she was sleeping a lot better up until a week ago. Okay. Something upset her and this affect her sleep. So something happened in her life. She didn't tell me what's going on. She just mentioned it. She didn't want to talk about it. And that's okay. So this time pulse. So last time was liver strong, right? This time is Mingmen week. And I used Mingmen week of 12 meridian. Sorry, I didn't have time to type up all this. The reason that you can see all this is because all this point is because I'm actually on the middle of to preparing my workshop next month. So I got this all ready so I can copy and paste to here. but I haven't up to Mingmen. Mingmen point is one of my last preparation of my presentation, so I haven't got it, so I didn't put it down here. I think there's another one I haven't got it too, either. You treat the point first, then check pulse, and then measure 12 in one appointment. Okay, that's the process. I don't treat the point first. I actually feel the pulse first. Pulse diagnose, then I find out which one I need to treat. Then according to the pulse diagnose, I choose the point, I needle it. As soon as I finish needle, I check the pulse again, see whether there's any change. Right? Supposed to change, then when it's good, it change, it balance, that means I'm right. If it's not balanced, I leave it for a while and I'll come back and check on it. Right? If the pulse change, which means my strategy is right, this patient is going to get better. If my pulse not change or get worse, if those two pulse, they should be stay in the same level. If it was that, I treat that, I try to bring it down. Then if I bring it to here, that means from here to here, that means I'm doing the right thing. If I bring it to here, that's even better. Now, if I, after needle, the pulse get that far, even far, that I know my treatment is wrong. I need to change my protocol. Okay, that's about it. So I can use the pulse to check whether my protocol is right or not. Okay, I don't wait until next treatment when the patient come back and tell me, oh, the last treatment is great. Oh, the last treatment it wasn't work that well. Not for that. Okay, I know when I put needle in, I know that this needle is gonna work because I have a way to check it. Then with Minimum Week, I do different herbs. You see, 八味地黄丸, I do different herbs. Okay, now on the 30th, after 7 days, bowel motion, it was last time was down to 2 times, right? 2 times down to once in the morning. So nothing at night time anymore. So she told me that because I want her to sit through the day and start with this treatment, she said something weird happened. If she take herbs in the afternoon, then she will go for another time. And during the day, it was about 5 times down to 2 times, right? Last time. And now she cut down to from 2 times in the morning down to once. But if keeps taking the herbs, then she go one more time in the afternoon. So we're not quite sure what happened yet. Type 4 in the morning. So it was type 7, right? Now type 4. What is type 4? Let's see. This is type 4, which is normal. You see? That's good, right? Sleeping much better and low back pain still. Now, the third treatment, the post is different again. Spleen strong. The proper way should be earth strong. The earth strong, the treatment principle is reduce earth, reduce metal, and tonify wood. Now you see, the first time we actually reduce wood, but today we actually want to tonify wood. It's so different, right? But the patient get better and better and better. Because as the organs get better, it will show you which organ do I need to focus on. Do we need to reduce it? We need to tonify it. Each time could be different. And how do we know? It's very flexible. It always comes from the pulse. So reduce earth means reduce spleen, stomach, which means needle spleen 5, stomach 45. Reduce metal means reduce lung and large intestine, which means you are needling lung 5 and large intestine 2. And liver and gallbladder, the tonify, and that is needling liver 8 and gallbladder 43. And the rest of the needles, again, Harari point. Right, I'm not going through that one for you because we have limited time today. Over here, because this is the main part. This is the main part. Okay, the rest of it is just Harari point. Then, as we have that, heat packs always there. Ichi 4 points for low back pain is always there. And so treating the organs again over here. This is the herbs. So you see the herbs only 0.51. This is not gram, it's just a very little spoon, right? 人参、生姜, ginger, 细辛五味子. This is for earth, this is for metal, and this is for liver. So when I do here, 1, 2, 3, 4, 5, 6, 6 points. You see 6 points. 1, 2, 3, 4, 5, 6. 6. Each point has its own herbs. Each meridian has its own herbs. Here you go. That's all in here. And the numbers are fixed. In tea bag, and take it 4. Take 1 bag with hot water and sip through the day. Okay, the 5th February. That was the beginning of this month. So she complained again, found if she takes herbs too quick, then make her more bowel motion or loose. So there's something in the herbs, she said. Bowel motion down from 2 times to once in the morning, nothing at night, so still resume, but in the afternoon. So if you find that if you stop taking the herbs in the afternoon, there's no bowel motion. If she continue taking the herbs in the afternoon, that she got more bowel motion, they actually lose. So there's something that she thinks is in the herbs that in the afternoon doesn't agree with her. If she takes herbs in the afternoon, then she will go for another time during the day, still type 4 in the morning, right? Again, this time is different, lung strong. So we got through what? Liver strong, spleen strong, lung strong, right? And what? Mingmen weak. And different herbs. I got the herbs, I haven't got the point in here. And the re-exam, the 13th of, not 5th here, that should be 2nd February. Herbs make her go to toilet, then watery. That's what she said. In the afternoon, if you keep taking the herbs actually make her to toilet, watery, right? This we found out. When the patient told you that, and that's right. We need to trust the patient because that's how she should believe in it. Okay, and that's how she tests it out. Okay, so 3 to 4 times bowel motion with the tea, type 7, even once a night. So it got worse a little bit in the last week of herbs with this. Okay, so she got worse a little bit, right? Sometimes you get this. She said last week was awful, right? So as you see, we get improve, but something happened, and I'm still not trusting my patient, because the herbs help her go through very well. And I want to find out what's going on in her life. I think something happened in that too, right? So we're not sure, and I'm just trusting my patient. As she told me, I trust her as well. But in the other side, I said, well, why would the herbs make you go to toilet? It doesn't make sense to me. Okay, but anyway, I listened. I didn't say that this herb didn't work, didn't cause the problem, but I questioned myself. I questioned the herbs, and I actually questioned the patient and want to find out what's going on in her lifestyle. Is there any change? But she keeps saying there's nothing changed. Not an emotion, nothing. All right. So I want to test out. I test out everything. So no bloating, even that her bowel motion back to type 7. Fingers are getting a lot better. So the joint pain's a lot better. So we know, even though she's back to type 7, 3 to 4 times bowel motion with the tea. That's what she said with the tea. And once at night time, she didn't get bloating. Okay, and the fingers didn't get worse, they can getting better. So this is the re-exam. I asked all the question again. I go through the so no palpitation for the heart, not in the last few nights anyway. Was sleeping very well. Okay, better in energy. For the last 4 weeks. Okay. Lung we can't tell because the weather is not cold. No dizziness. She used to get vertigo and sometimes dizziness, and hasn't been happening. No bitter taste in the mouth. Joint pain reduced a lot. The blurry eyes still the same. Decreased night vision still the same. Yeah. No floaters in the eyes at the right side, in the right eye. It used to be floaters in there, but not anymore. Kidney, not hot flusher after hot cup of coffee, so no hot flusher. No night sweating. It used to happen in the summer sometimes, and hasn't been happening. Thirsty all the time is better. Lower back pain still when she get bowel motion pain, then go to the lower back, and that's still happening. Wake during the night at least 1 time to urine, that's still better in energy, so more energy. So the biggest change in here, no stomach pain, no nausea, no fatigue after eating. Yes and no to lose bowel motion, because she was getting better. Then in the last week, she got loose bowel motion again. All right, that's big question mark. Why did she get that? We haven't really figured it out yet. So no undigested food and stools, no abdominal bloating. Well, you can look at it down and here when you get the presentation. Okay. You can't hear me now. Why can't you hear me? I don't know why you can't hear me. Can't you hear me? That's funny. Why can't you hear me? Yeah. I'm still talking. I'm still talking. Why can't you hear me? Okay. So the patient's getting better. Can still hear me. That's good. Okay. So you see 4 weeks, only 1 acupuncture weekly with herbs every day. All right. And actually, the next plan I actually give patient is no herbs, because she was a bit worried about herbs. I said, no herbs, just do acupuncture right now. All right. And do your acupressure program. All right. So she is doing very well. She do the acupressure program every day, and she does the acupressure program, and she does what? She does the diet, okay, and she does what? She does what? Follow the diet very well. She do the best herself to try to get herself back to normal. And I told her that if you follow what I suggest, it's a trial, and then we're gonna see what happened, right? And she does the heat pack every night, every day, half an hour, and that's important for her to get better. Okay, and the other thing that she did is Ho'oponopono method every day. Yeah, she did very well, and she believed in God. So I asked her to pray every day, and she does, and that's very good. Yeah, if you do 生灵白术散, this is about 生灵白术散 is about stomach and spleen. Right? It's good formula. But I have another way to do the herbs because I don't do those formula, like just ask the question and diagnose and give herbs. I don't do that anymore. I only do pulse. Okay, because I believed in pulse much better than just asking the question and get the answer. I used to do the same, that just ask the question and don't care about the pulse, but now I do the opposite. You want to see the video you send to patient? I need to think about it because it's got my I've got one video actually in public. Everyone can watch it because before patients see us, they have to. It's an education a video, right? The other video, I'm not sure about the other video. I have to discuss with my team because this is the assets for my clinic. Okay, I need to think about it. But good question, thank you. I'll think about it. All right. So this patient now is continuing with acupuncture once weekly because we test out this acupuncture work for her very well, and because she thought that herbs making her go to the toilet a lot more in the afternoon, but not in the morning. So something's happening when I actually not sure whether it's from the herbs or actually something that in her diet or her emotional problem. Okay, so I cut down. Was it let's do a test? Don't use herbs, and we'll see how you go with acupuncture. Just acupuncture, still once a week, and then I asked her to keep going with the acupressure program and everything. Then she doing it, but this week when she came back, and the first time, second treatment plan, and she got worse. The reason that she got worse and she wanted left because she'd been worse for a while, for the last week, because she was thinking about whether she want to continue. I said, yes, you need to continue. You're not complete. The organ is still a mess. We now test it out as good now, and a lot of patients thought that they can keep going by themselves. And then she tests out that she couldn't. Her function dropped very quickly. She go back to type 7 again, without any herbs and acupuncture for a week. Right? This is how we can see it. When she was on treatment, she got a lot better. When she off treatment quickly, cut it down too quickly, then things happen. And then she went through emotional things, other things happen. So we know that things happen in her life that actually affect her tummy to go about lose bowel motion, and painful. All right, painful. And her husband actually got attacked from someone, then that make her even more anxious. So then I put needle in when she came in, and all the pain went away, and she kept passing wind, and she was nausea and one vomit, and everything's fine. After same thing, use pulse and needles, and that's it. Okay, and we prove it to her again that acupuncture directly, instantly will lift everything for her, and she trusts acupuncture very much. And I do tell her that that's because something happened in your lifestyle and it actually affect your tummy, right? So anyway, we're going to go for another month for this patient, and we're going to sit down and see how things going. And then we're going to continue with the treatment. I'm going to, suggest other treatments, right? We're still testing it out. Every time we test out which one's best for patient, which one's not good for patient, and we take it away, and we invite it again and see what's the difference. All right, this is my strategy. Okay, you're back and you can hear me again. That's good. Can you tell which acupressure point? Go 1, 2, 3 meridian therapy on Google. Okay, this is something that I use similar to that, and I actually use others. Like this is the basic one that I give to my patient. All my patients need to do this. Not everyone do that, to be honest, but those that been practicing that, they get better results. And I actually remind them. Some patients keep forgetting about this. Then what happened is I get my patient to do other acupressure program as well, according to what they have. And I will show you guys if you join my workshop next month, and I'll show you guys how to do that. And it's from Hongdi Neijing. And it's very simple, the acupressure point. All right, so we're going to talk about 12 magical points. Now, the 12 magical point that you can use, if you don't know about pose, this is the 12 magical point that I suggest you to use. Treat all meridian and using Harari points. So lung 8, PC 8, heart 8, spleen 3, liver 1, kidney 10, large intestine 1, Sanjiao 6, small intestine 5, stomach 36, gallbladder 41, UB 66. All right, and how do you needle it? If you needle here, 3 in, then this is 3 yang. 3 yang meridian on that hand, 3 in meridian on that hand. Now, if you needle here 3 in, right, on the opposite side, that leg, 3 in foot meridian in here. Now, because this side is 3 yang, so foot 3 yang is over here, the opposite side. Match yang, match in. If you draw cross, right? Does it make sense to you? So 12 magical point, only 12 needles. A needle over here. If you don't know how to check the pose, you can still use 12 magical point, and it still work for that. Well, but if you know how to do pose, then it'll work even better. Okay, it'll work even better. So 12 magical point, I tested out already. This point are work as well. These points are working as well. Okay, but not as good if you know how to determine which one you need to actually focus on. All right, plus this is a 12 magical point that strategy that I suggest you to use in any condition, especially for diarrhea, IBS. And the other strategy is magical 8. Then you see on the right side, PC6, lung 7, that's right hand, right? On the left foot, in meridian as well. Spleen 9, level 8. Or Dr. Tan level 8. If you don't know about Dr. Tan level 8, just level 8. On the left hand, Sanjiao 5, large intestine 4. On the opposite side of left hand, which is right foot, stomach 36, GB 34, right? So this is another strategy, very good for diarrhea. Okay, next question. So what is the difference between Magical 8 and Magical 12? What's the difference? Because I show you two different strategy, right? A Magical 12, you can just use this one. But if you know pulse, you can do it even better. If you don't know about pulse, you can choose this one. And how do you choose those two, right? Which one's better for your patient? Over here. Magical 8 in acupuncture 1. So when we talk about balance method acupuncture, we're gonna go through acupuncture 1, 2, 3. Acupuncture 1 is 6 meridian. So with Magical 8, the patient come to you, they just have problem in here on the tummy. They don't have any other conditions. Just in the tummy. The meridian involved in the tummy. On tummy over here. Whatever meridian you find here, just in the tummy, don't have any pain and any other symptoms at all. Then you use Magical 8. Now, if they have pain in here and they have headaches, they have pain in the arm, backache, knee pain, whatever pain in other area, then I would suggest you use Magical 12. So that's the two different simple way to tell using which one's better. Okay. Yep, this is my suggestions. Or even though they have pain over here, whatever, you can still use Magical 8. You can do two or 4 treatment to test out which one's better. Like you give patient Magical 8, and you ask the patient, next time when we come back, we're gonna do another different protocol. And you're gonna, in the third treatment, you're gonna tell me which one is better. So the treatment 1, you do Magical 8. Treatment 2, you do Magical 12. And treatment 3, you ask patient which one work better. Or if they both work better, they both get them immediate relief or bloating or pain in the stomach. And the next question is you ask them which one lasts even longer. Okay, so something like that. Or you can palpitate before you needle. You palpitate the tummy and you find a sore spot, and then you needle it and you go palpitate the tummy again, and you see which one is better. Okay, there's a few ways that you can do that to test it out. Okay, so what is the best strategy? So the best strategy for diarrhea, for IBS, is always go to 脏腑 organs functional diagnose. You need to look at the whole body rather than just, oh, this is a digestion problem, and I just give you this herb, or I just give you Szenan-Balance or 六君子汤. This is not the best way to practice. I don't agree with that, right? And always tell the patient you're not relying on me. Right? Always tell the patient you're not relying on my acupuncture or Chinese herbs to get better. Okay, if you're relying on me, you just want to come here and get treatment and get better. I said you're coming to the wrong place. I said you need to help yourself to get better. We need to work together. Right? You come here for acupuncture and Chinese herbs. Yes, that's great. I can help you. I'm happy to do that. But once you go through the initial examination, you think they have emotional problem, you need to suggest something for the emotional, because when the emotional up and down, like this patient, when there's something happened to her, she will react differently, angry, worry, then she get lose bowel motion. And that just happened recently. And then you want to suggest the diet. I don't know about you. I tested out the diet. The best diet is what I actually practice there. And heat pack is the best way that they can do at home. At summertime, they still use heat pack, but don't put it too hot. Okay, in summertime, just do half an hour every night. Put it on the belly button, because heat pack can draw more blood to the organs and to recover the organ function. Without blood flow, nothing's going to happen. EFT. Not sure about EFT. I think I heard about that. That is one tapping technique as well. Tapping, and that's very related to acupuncture. And there's a course for it. We have the course. I just haven't studied it for years, and you can do that too. And I actually teach my patient because I know a bit about it, and my wife practiced that. And she taught me that how to use it, and I actually show my patient how to use it with my Ho'oponopono method, and it's easy. And you can tap it on the point. You can Google those as well. Oh, that's the same thing, is it? Okay, yeah. That's related to acupuncture point. That's very good. Yeah, I've seen it a lot on YouTube. And so I do DIY acupressure. Okay, so I use a combination treatment to my patient. I don't just use acupuncture or Chinese herbs. I used to only do Chinese herbs or acupuncture or both together, and I didn't actually suggest diet or emotional practice. But when I got to emotional day practice and change my patient's diet, and I find the results are much better, much quicker to see the results, and the results actually lasting longer. So what's the best diet for diarrhea? So there's a question for you guys. If the digestion system is weak, do you want to give your patient or yourself something that easy to digest or difficult? Yep, DIY is do it yourself. So I actually DIY, give patient do it yourself acupressure point. Plant food. Yep. Easy food. Yes. What else? What would you suggest? Soup, cook food, warming food, avoid cold food. That's good idea. Now this patient actually get cold water, drinking cold water a lot. And I said, stop doing this. And she stopped. And then that's why she get better quickly. So she get cold water out of fridge every day and drink it. One of her habit. A lot of people do that. Ginger, roquefort, and milk. Yes. Ginger, roquefort, or what you suggest a good food is with ginger and roquefort. But some people can't eat ginger and roquefort because they just can't handle the smell or they can't handle the spice. So always test it out. If they have dairy problem, they take dairy, take cheese, and they make them lose, stop it. And I actually ask them to stop dairy. Gluten, I actually don't stop the gluten, but if they can't handle gluten, they can't digest gluten, I say stop it. They test it out. Good idea. Avoid food that are hard to digest. Bone broth. I don't do that. Nothing too strong to and flavored in a must. It's a must. I know a lot of people, a lot of American acupuncturists do bone broth. Suggest patients drink bone broth, and I won't suggest my patient do that because I realize that the animal protein are much worse for my patient, and I have a lot of research for that. Okay, a veggie and meat. There's veggie plant protein and meat protein. Which one is easier to digest? Plant, yes. That's why veggie, yes. Right. That's why I actually suggest my patient to go vegan or vegetarian. This is my answer. So dietary review and suggestion in my video. I actually teach my patient to look at the plant and the animals protein. Yep, you're right. So in vegan diet or vegetarian diet, I want my patient to chew properly first. So to eat slow, so chew, so the yum, and then 30 times or 20 times, 25 times, basically 30, and then use the tongue to check what the food inside all the food inside of the tongue, and see how refined they are, and before they swallow it, and do a test first, and then another time use the normal speed to eat before they swallow, and use the tongue to check how big the food is, even though they are vegan or eating plant. And then when they realize that, I ask them, "Wow, is this big of food and this big of food? You know, which one gonna be easier to digest in the tummy?" Of course, the smaller one. The first part of the digestion is in your mouth with your teeth. This is the first part, not in the stomach. The stomach is actually second part. So getting the patient to eat slow, chew it properly, is the first thing that you need to do. Yep. Okay, so this is the diet. I just tell you that this is my suggestion to my patient. Okay, you may have other idea, and we can talk about it another time, right? So because the time is actually running out, so I have a workshop that is next month. Okay, I'm gonna show you so the early bird still exists. I think 13 to 15 March 2020. The full price is 1,500 New Zealand dollars, including GST, and the early bird is 999 before the 2nd of 3rd. So it's coming soon though. So if you have attended my webinar, the pay online webinar, or any of Dr. Tan's Eileen Han or Dolphin Balance Method Acupuncture previously, that you can get just 699 early bird price for before the 2nd of March. Okay, I'm gonna give you all this details. Give you a minute. If you have any question, you can ask in here right now. I'm going to in my workshop, if you don't know about how to do the pose, I'm going to teach this in my workshop this time. So the medical 12, how to use the pose, is my main focus in this workshop. What kind of heat pack? Okay, not everyone have the wheat pack. I use wheat pack in my clinic. So I ask them if they don't have wheat pack and don't have microwave at home, that's fine, because some people don't use microwave. We do use it in the clinic. So it's a quicker way for us to do it. We don't use heat lamp because heat lamp is, taking out space, and I find that heat lamp, heat pack is much easier to use and much warmer for my patients. So I use heat pack. And we sell heat pack to patients. So if they wanted to, or if they don't have it, they can just use hot water bottle. So this is the link that if you want to join my workshop, this is the last early price chance before the 2nd of the March. And the last thing that if you want to know about the bonus. So I'm going to give you a bonus, free medical aid to treat heart disease. All this, you only know the point, but how it comes from. If you want the webinar, you can go through this. Step 1, sign in your Google Mail account first, then click this link. The link I just posted down there, and to write me a honest Google review about my vlog and my webinar or today. Then send it to our email address. Screenshot and send it to our email address, and we'll send you the link. Attention, if you have any question or suggestion, please send email to us. Do not ask any question or write your suggestion on our Google review page. If you don't want any of my bonus webinar, you don't need to leave me any Google reviews at all. Okay, that's it. All right. This is about it. I'm going to show you the tongue of this patient if I can pull it out from here. Tongue. Okay, have a look. This is before treatment. This the left one. The patient tongue, you can see that coating, and after treatment for about a month, you see how the tongue clear out. This is beautiful. Okay. So this is the difference. Treating the pulse and the tongue actually change. All right, that's it. Any question? Now, if you don't have any question, you want to go, there's time to go now, it's fine. All right, awesome. Thank you for your talking. Do we have quiz after? No. You can leave now, and I will run the report, and the report know that you stay until now, and you will get I'll send you a certificate. Awesome, Aaron. Thank you. As always, a lot to learn and to build on. Thank you. Thank you, Aaron. Thank you. Thank you. Good night. Thank you once again. Thank you, Michelle. Thank you, Sumei. Thank you, Hewon. Have a good night. Yes. Right. Those two medical aid and medical 12 are the protocol that I use a lot for IBS. A lot. Okay. It's just in the medical 12, I actually have another way to practice it, to use the post to find out which one is the best to go. If I can't find any from the post, then I will use all Harari point. So do I need to make Google review? I've done it last time already. No, if you have done it, you don't have to do it anymore. And if you've done it, you must go to the medical 12 webinar, and that's a free bonus webinar. But if you haven't done it, you want the medical 12 webinar, then I actually teach you why and how they what's the point and how you diagnose, how to use it in one situation that you use those points. And yeah, if you want those, you can go ahead and do the Google review. And if you don't want it, that's fine. You don't need to go to do the Google review. It's just a bonus for everyone, and actually helped me to build up my new clinic in Auckland that built up the Google review as well. And thank you. Yes, we're going to stop recording right now. Thank you very much. If you have any question, you can ask me.